My name is Danny Pike. I'm a family physician at Christ Community Health Services. I work at the Orange Mound Christ Community Clinic, and I've been there for 5.5, almost 6 years. I also live in the community in Orange Mound, like a block from the clinic. Been there for about 6 years. So you're right. I mean, certainly a lot of our patients, adherence is an issue. I think, one, keep it in mind that their base level of health literacy and education is not great. And so having some compassion in that, remembering that where they're coming from, and definitely there are days where it's really frustrating. You feel like you're banging your head against the wall, and you're having the same conversation you had 3 months ago. And but I think also, having been in the community now for almost 6 years, like building relationships with my patients, also with my neighbors and people like my patients that are coming from a similar situation, like that helps me see where they are. Yeah. I think too, holding on to those little victories. So a lot of my patients, it can be difficult. You make small little adjustments and small little victories along the way, and then sometimes, you know, 1 out of 15, you'll have a patient that takes their A1C from 12 down to 6 in 6 months, and you think, oh, he got it. You know, I am seeing some improvement. He gets it. I'm making a difference. And so I think kind of holding on to those things along the way, and kind of seeing where patients come from. That's what helps me stick to it. Yeah. I would say, one thing I would say would be listen to your patients. I would say that to providers as well, to docs or mid-levels, but nurses as well, because honestly, a lot of times nurses, you guys are with patients more directly than even providers and docs are. But listen to your patient, and because a lot of times if you actually listen to the patient, they're telling you a lot of the story that can help you figure out what's actually going on. You know, a lot of what we do as healthcare providers is sift through stuff to actually know what's going on underneath the surface. Not only underneath the surface in their life as far as their heart or why they're not taking their medicines or why they're depressed, but also just what's actually going on medically. What diagnosis are we actually looking at? So I think that's one thing I would say. I'd encourage anybody in the medical field is actually listen to the patient. Sometimes that's difficult with patients, but that's important.